Hi, I'm Dr. Wendy Thiessen, a pediatrician at McFarland Clinic in Marshalltown, Iowa. I'm coming to you with an important message that can help protect the most vulnerable members of our community, infants. We're talking about immunizations, many of which have been around for decades and have helped the United States virtually eliminate awful diseases like polio, rubella, diphtheria, whooping cough, and more. Let's quickly cover the diseases babies are at risk of contracting and the vaccines we know that they need to have to be protected. Hepatitis B is a deadly disease that spreads through the blood or other bodily fluids. More than 780,000 people die each year due to complications of hepatitis B. We begin this vaccine series just shortly after birth. Rotavirus is a contagious disease that can cause severe watery diarrhea, often with vomiting, fever, and abdominal pain. These symptoms can lead to severe dehydration. The vaccine to prevent this is given in 2 to 3 doses. DTaP is an acronym that's short for diphtheria, tetanus, and pertussis, or otherwise known as whooping cough. This single vaccine protects against all of these diseases and is given in a few intervals throughout the child's first 6 years. Haemophilus influenza, or Hib, is a bacteria that isn't well known, and this is because of the existence of vaccines. Hib can do serious damage to a child's immune system and can cause brain damage, hearing loss, or even death. We typically give the Hib vaccine in 4 doses. Pneumococcal disease is caused by bacteria that can cause ear infections, sinus infections, and even more severe infections such as pneumonia and even meningitis. Our children are particularly vulnerable to this bacteria. We give 4 doses of the PCV13 vaccine to provide protection. And then we have the poliovirus, a potentially deadly infectious disease that can invade a person's brain and spinal cord, sometimes also causing paralysis. Vaccines had virtually eliminated polio in the United States over the last decade, until an outbreak that occurred earlier this year in a community with low vaccination rates. This really underscores the importance of continuing to vaccinate against these diseases. The good news is, we are able to combine many of these vaccines into one shot so we can minimize the number of pokes children need to receive. Finally, I urge you to make sure that you, your family, and friends are protected by getting all the vaccinations recommended by your primary care provider. Vaccines are safe and effective, and that's why I ensure my family gets them too. If you don't have a primary care provider, the Marshall County Public Health Department can help. Call 641-844-2799 or find the Public Health Department online at marshallcountyia.gov.